You ready? Roll call.
Mary Baker Shaw,
Aye.
Mike Dobbins, Keith Austin, Harley Buzzard, Joe Byrd, Julia Coates,
Here.
Sean Crittenden, Joe Deere,
Honey.
Kanan Duncan, Rex Jordan, Daryl Legg, Wes Snowfire, Dora Petzkowski, Mike Shambaugh, E.O. Smith, Janice Taylor, Victoria Vasquez. We have a quorum.
Thank you, Shelley. Now for approval of the minutes, can I get a motion? Motion to approve the minutes. All in favor, say aye. Aye. Thank you. And our first report, Claremore Service Unit. And George Valerius, you're with us today. Hello,
Good
George.
afternoon. Hi, good afternoon.
Good afternoon. How are you doing?
I'm doing well, thank you.
Thank you. What would you like to tell us about your report?
Well, you have, I think you have my report in front of you there. Yeah, it says there that we're vaccinating patients 55 and over, but actually this we have started vaccinating. We've opened it up to 18 and over for the Pfizer and 16 and over for, or maybe I got it backwards. 16 and over for Pfizer and 18 and over for Moderna. We actually have both vaccines in house. We're giving those.
Shelley, can we get the volume fixed? George, wait just a
Pardon me?
second. Is it on George's end? George, if you could speak closer to the microphone, maybe?
Okay, is
Oh,
that any
thank
better?
you. Yes, that's better. Thank you.
Our vaccine clinic runs 7:30 a.m. to 3 p.m. every day. The testing outside, the drive-through testing is 8 a.m. to 4 p.m. Infusion clinic is 8 to 4 every day. And it's in the back of the building by, in the old physical therapy area. We have also, I'll say it again, we have opened up the vaccinations to all age groups. I believe it's 16 and above for Pfizer and 18 and above for Moderna. So, but that's pretty much our emphasis right now is getting as many people vaccinated as we can.
George, could you tell me what the difference is, why you all are doing 16 and above for Pfizer and 15 and above for Moderna? What was the breakdown on who got what on that?
That was a recommendation from the manufacturer.
From the manufacturer? And you've just got it open then to all ages. Are you all booking appointments?
Yes.
Can anyone just walk in?
Right now, yes, you can. Our appointment number for the vaccine is 918-342-6580. And they have also on our Facebook page, I think they have put a link to, we have opened up a portal to help make appointments that if our patients are able to, they can get on the portal and actually pick the time that they, date and time that they want to come in and get their vaccine.
Very good. Very good. George, are you all back on track with surgeries and regular scheduling for tests, exams, and things?
The adult medicine clinic, pediatric clinic, women's health, they're all running as normal. Surgery clinic is still running just emergencies only, as is dental. They are running, dental is staffing the drive-through testing facility, and surgery nurses are doing the vaccinations for us right now.
Very good.
We hope to get both those back open shortly in a couple weeks.
Very good. Does anybody have any questions? Counselor Buzzard.
Yes, George, tell me again, I misunderstood. What are you doing in dental right now?
Just emergencies only, sir.
Okay, emergencies only? And
Yes.
I missed the numbers a while ago. How many shots have you administered so far at Claremore?
Oh, I don't I don't have a total number of vaccines, but I'll get it for you.
Okay, that'd be interesting to know. Okay,
Okay.
all right, thank you.
Anybody
Uh-huh.
else with any questions? I'm not seeing any hands. Well, Mr. Velour, we sure appreciate you joining us today, and we hope everybody's well and safe up there in Claremore.
Well, thank you. Thank you, guys.
Thank you for joining us. Okay, next up we have is Dr. Steve Jones.
Good afternoon.
Good afternoon, Dr. Jones. How are you
Can
today?
you guys hear me okay?
Yeah, we can hear you great.
Okay, good deal. All right, well, our report is in your packet.
Dr. Jones, just one moment. I'm
yeah.
sorry. Can you speak a little louder?
Yeah,
Thank
let me
you.
turn it. Is that any better?
Is that better, y'all? Yeah, they're saying yes. Thank you.
Okay. So my report is in your packet. I won't go through and read it all. I'll hit a couple of highlights that we usually hit on. So our contract health approval rate for the month of December was 97.1%. As you know, we kind of fluctuate between 96 and 99. So 97.1. As you can imagine, some of our revenue is a little down, but not as far off as you might think with all the disruptions that we've had in our services. And then on the last page, you can see our testing as of the December report. So back in December, of course, we were still hitting high numbers on our testing, but our testing has fallen off quite a bit since then. So the number is going to fall down on the next report, and we've made some adjustments accordingly. So a couple of things I do want to highlight that I get questions on frequently. The hospital surge plan, we've pulled back from that now that we've seen our numbers drop and our hospital vacancy has come up a little bit where we've had some beds available to be able to admit patients. So we pulled back on our surge plan, and by doing that, it's freed up some staff, and we met last week and decided to open up elective surgeries again. So starting this week, they will open up surgery clinic to normal capacity. So we do know we have a backlog, and we'll start working through that backlog now. Our MRIs were backlogged quite a bit. Our radiology staff, I have to commend them. They came up with some creative ways to get that list down. We had over 900 in our backlog. They worked longer days and on the weekends and made available for patients to come in, and we've got that down to about 100 now. So they've reduced that backlog quite a bit. Our dental and optometry clinics, we have been utilizing those folks in our testing and vaccine clinics. But we have started this week back up to 33% of our regular scheduled appointments on top of our emergency care. And those regular appointments will be, we've been tracking all the ones that we've had to reschedule. So we're starting to work through those and get those people back in for routine care. And we'll start opening up more capacity as we have been able to pull more people back from the testing and vaccine clinics as we've been able to find more resources for those folks. We are transitioning, like I said, from doing a little bit less testing and more vaccine. Today was the first day. It was supposed to be last Monday, but because of the weather, it pushed us back a week. Today was the first day that we opened up vaccine clinics at all of our healthcare facilities. Stillwell's a little different because of the construction going on there, so we're using the new building that is located up by CNI to do the vaccine clinic there, and it will be drive-through. So all of our health centers will have availability to vaccine as of today. So we also have opened up our patient portal to allow patients to make their own appointments on top of the call-in number. So that's available today, and they can make those appointments 24 hours in advance as those schedules open up. We are in phase 2B, which was everyone with a underlying health condition. We also opened it up to teachers and first responders of all ages. So, and today we have scheduled 1,350 vaccinations. That number will increase as we get our processes more honed in each day. We're anticipating getting up to 2,500 vaccines a day. That's our goal, is to get up as the allocations have become more open to us and we've been able to get more vaccine. We're able to increase our appointment scheduling up and scale up. So our goal is to get to 2,500 a day across the Cherokee Nation. And currently today, like I said, it was 1,350 scheduled. We hit 20,000 vaccines last Friday, 20,500 on vaccines given. So our numbers are start exponentially growing each week as we get closer to that 2,500 a day. And as I said earlier, our testing numbers continue to drop, those folks that are that are coming in for testing. So, but our positive test rate, we are monitoring that very closely. 2 weeks ago, it dropped down to about 12%. Last week, it went back up to 16%. And that could be because of the weather. We had less people coming in to get tested, so it throws the numbers, it skews the numbers a little bit on percentages. But we are watching that very closely. We want to make sure when we get down to that 10% rate, then that's when contact tracing and case investigation allows us to have a little bit more effectiveness at boxing in those hot spots. And we definitely want to do that as that tool becomes more useful moving forward. And then the last thing is, of course, we're doing some things to recognize our healthcare teams. CMB has graciously reached out to us and is providing lunch to all of our healthcare staff this week. So we've got different clinics scheduled at different times when they'll be coming in and providing a box lunch for each staff member. So we appreciate that, and we want to thank them for that, and our folks really appreciate it too. It's just another way of someone else reaching out and telling us, showing us their appreciation. So we do appreciate that. And with that, that's all the things I wanted to highlight today. So I'll be glad to answer any questions.
Okay, anybody got any questions for Dr. Jones? Chief of Staff Enlow, did you have a question?
As Dr. Jones illustrated that we've expanded our operations and our locations, so one of the things that I ask each of these council members to do is if you could help us to advertise, encourage people to go get vaccinated with that expansion. As Dr. Jones indicated, we're hoping to do 2,500 vaccines a day. And so future allocations will be based on our ability to distribute those and get them in the arms of patients and people to make sure they're vaccinated. So just be one thing I ask you for your assistance to help us get that messaging out and encourage people to go get the vaccine.
Very good, very good. Counselor Buzzard.
And Todd, I didn't hear Dr. Jones, and he probably answered the question about what age group can go and get those vaccines now?
So right now we're 55 and older.
Okay.
And then those that have underlying health conditions, and then any teacher or first responder inside the 14 counties that's affiliated with a tribal nation. So as long as they're a citizen of a tribal nation, they would be eligible for that. So they have to be eligible to receive benefits out at an IHS facility.
Okay. The other question I had for Dr. Jones, I had sent a email to Mary Baker Shaw and Dr. Mike, mine went blank. Anyway, I sent this out, several weeks ago about pregnant women using our clinics and hospitals. And I just want to put this out to the other council members to see if they have any feedback or have anything to say about it. Because what I'm still hearing is that, Dr. Jones, thank you for a response. But what we're doing now is all the pregnant ladies come to Tahlequah to do blood work, to do the do the checkups, and to see a practitioner. Well, I have some people in my district can't afford to drive to Tahlequah on a weekly or a monthly basis to get that done, and I don't know if they're getting help with gas money. The other thing is, Dr. Jones, is we have people that are poor people. They can't afford to drive to Tahlequah to have a blood test. We can do blood tests at our clinics. Now, I think in your email, you said, well, they may have to have some special blood tests, but I'm saying all of this because the travel time that it takes for a person to take off from a job that live in Bartlesville to come to Tahlequah, it's going to take 4 or 5 hours that day of their time, and they need that job to bring money home to their people. The other thing is the labs in our clinics. We have labs in every clinic that can draw blood, and the way I understand it now, those laboratories send the blood work out if they have to be analyzed further. That was one of your things that you said they had to do the lab here. But, you know, with all of our clinics out here, and I don't know, to me it seemed like a simple solution to not have our people to drive to Tahlequah is to send a provider out or a nurse to do those prenatal checks. If something should come up that they need to go to the hospital, then send them. But having a person to drive from Kenwood or Jay or Grove or South Miami to Tahlequah to get a lab check is just, I guess I'm looking out for the people that can't afford all those trips to Tahlequah. Your answers, you know, to me, they were answered by a person that has all the money in the world, that could jump in their car and go down there, and people that didn't have jobs that could stay away from their job for 5 hours. But anyway, I just wanted to bring it to your attention again that we have poor people that can't afford to travel to Tahlequah, and we have poor people that can't afford to miss 5 hours of work today. So anyway, I just want you to go back and take a look at that and analyze it to see if we couldn't do something different to help our people that needs that help. I don't know, it just seemed to me like that you could set one day aside to each clinic or have a provider to go one day to each clinic. So anyway, I just want to bring that to your attention. I want to see if the other council members have that same feeling, or is it okay for people to drive from Bartlesville or Nowata or to Jay to drive down here to do those checkups? It just seemed like we're not serving our people the way that I would serve them if I was a doctor, but I'm not a doctor. But anyway, I just want to bring it up and let the other committee members hear, you know, what's going on out there, because you may not know what people are telling me. So anyway, just want to bring it to your attention, Dr. Jones, to see if we couldn't look at doing something like that. Thank you.
Madam Chair,
Yes, Speaker Byrd.
before I'd like to make a comment, I'd like to hear what Dr. Jones's response was to Councilor Buzzard.
Well,
Doctor,
I can read you his response if you'd like.
Okay, and I didn't know they were driving from Bartlesville.
Well, the reason they drive is because everybody has to come to Tahlequah, and if you got a pregnant lady in Bartlesville and they want to use our clinics, then that's what he says, they come to Tahlequah.
They wouldn't use Claremore from Bartlesville?
Well, they want to use the Cherokee Nation.
not
Clinic.
inside if they're in Cherokee Nation.
Okay, Dr. Jones, you're up.
All right, so number one, they can use our labs. If it's just routine labs, they can go to our labs, and that's where the order will be put in for them to use our labs. But to see a specialist, to see a pediatrician or someone who is a specialist with labor and delivery, then they will need to see our specialty doctors that are located in Tahlequah. To send those doctors out to the clinics is, number one, is counterproductive from the standpoint of it takes their time to travel that they could be seeing patients. There is assistance available for people who have issues with gas money. I think as counselors, you have assistance that you can utilize for that, and we have assistance that we can utilize for that if we know a person has that hardship. Those specialists are limited, and we have to make them the most efficient they can be to see the most patients that they can see. Of course, we are hitting higher numbers than we've ever hit. We have had record deliveries in the last few months, and we are anticipating that to continue. So that's the reason that we have it set up the way we have it set up. And it's the same way in the private sector. If you were going to see a specialist, you would probably have to travel to Tulsa to see them. You don't find those specialists in small towns, unfortunately.
Dr. Jones, would it not be possible to send a nurse practitioner or something out to just do routine prenatal visits? To our
We have
clinics?
nurse practice. We do have nurse practitioners, and we do have family practice docs at every one of our clinics, and it depends on what their comfort level is in seeing those patients and what difficulties those patients may have is what will require them whether or not they need to see a specialist or not.
I understand that. I just didn't know if we might specialize, have a nurse practitioner that could specialize in OB and, routinely make the circuit of all our clinics on a regular basis and be scheduled one day, every 2 weeks or something.
It really comes down to resources and what we have available to us to use and where they're being used at, on whether or not to put those people on the road and spend that time driving and traveling and not seeing patients versus having the patients come to them where they can see a full day of patients. And again, like I said, we have resources that are available to people. And in the past, we've even had transportation up until when COVID hit to transport people to and from the clinics. COVID has put some limitations on what we are able to do and not do. So as we get further along in this and we get to where we can open up those transportation vehicles again, then safely, then we will do that. But currently, unfortunately, due to the limitations we have, we're limited on what we can do. But there are resources to allow for helping people with gas money when they have issues with finances.
Thank you so much for that answer. Counselor Bezer, did he answer your questions?
The policy that I understand on gas money, if you come to a Cherokee Nation clinic, it's not available. It's only available if you go to St. Francis or to any clinic outside the Cherokee Nation. If you went to the clinic in Jay and asked for gas money to come to Tahlequah, it's not available. That is my understanding of the policy.
Have you got some specific instances where we turn people away or not paid for help them with assistance if they've needed it?
Yes, I've had citizens go up there and need money to come to Tahlequah Hastings, and you said, and they were told that you can't get that money. Now, if they were going to the city hospital in Tahlequah, they could get it. So that's the difference in those policies, is what I understand.
If you could send that specific instance to us, let us know, because I don't know of anybody that we've turned away on those type of situations. We have tried to accommodate everyone, especially with our transportation vehicles being down due to COVID. We've tried to accommodate through our patient advocates anybody that has needed assistance.
Well,
so
that's
if you can send those to me, I'd be glad to look at it.
That's the patient advocate is the travel you're talking about. We have one or two vehicles at Jay, and you only have two of those people that do that. And if you got an appointment, sometimes you can't get those people, but they go in and ask for travel money, gas money is what it is. And they're telling them, no, we can't give you that gas money if you're going to go to a Cherokee Nation facility. You can only get the gas money if you go to Tahlequah City Hospital, St. Francis Hospital, or those type of clinics. So
Contract related.
yes, and so I don't know if you could send us that policy. I'd like to see it, so I don't know what to tell people.
Well, if you can send me the specific people that have had issues, I'd be glad to look at it. But since our transportation's been down,
Why can't you just send us the policy and let us read it for ourselves?
we can do that. But
Okay,
I'm telling you,
that'd be
we
better.
have.
Because I can't
since we
remember
have-
all the people that's called and told me that they can't get money.
Since the transportation vehicles have been shut down due to COVID, we have not been doing transportation between clinics. Very rarely are we doing that. It's extreme cases that we allow that, put someone out to do that, mostly having to do with dialysis. But since that's been down, we have been very flexible in our policies, allowing to use those funds that we have available to help people with gas money. So I don't know of specific incidences where we haven't helped someone. To my knowledge, if they have talked to our patient advocates, we've tried to help every single person that has come across as needed resources. So,
Yes, well, we haven't had a patient advocate at Jay since last March, so we don't have that person there. But if you'd send me the policy, Dr. Jones, that would clear it all up. And if people call me again, I'll say, no, you're eligible to get that gas money, travel, so that would help. Thank you.
Okay, will do.
Okay, thank you.
Okay, Counselor Crittenden.
Yeah, Todd answered one question. Is it all right to say that, or? Anyway, my question was about support staff at schools and bus drivers and cooks, and he said that was a good deal too, so, on the vaccine. Hey, Dr. Jones, you might shoot me out of the saddle here for this question, but telemedicine, I just kind of figured there would be some of that going on at our emergency room. There was an incident we had, and it was late at night. I was talking to someone there, and he was asking me about the situation, what it looked like, and I said, well, do you have any sort of telemedicine? And he didn't. Is that just a staffing thing, doctor, or is that just something that wouldn't be used that often? Telemedicine available to our emergency room? Thank you.
So telemedicine usually in the emergency room setting is only used when someone's in a room and they don't enter the room. They do it through video from the desk to the room, but we don't have a emergency room telemedicine, I guess, availability. Now through urgent care, there is some availability through telemedicine through their family, their primary care physician. If they have one, or if they don't have one, they can get one assigned, and then they have the ability to do telemedicine through that. But at after hours, we have the urgent care available till midnight, and then the ER available 24/7. But we do not have telemedicine in the ER. You're not going to be able to call a number and do an emergency visit into our emergency room. You have to go there in person.
All right, and when the dust settles of all we're dealing with, it may be something we can look at later. It just seems like there may be some situations where it'd be handy. Appreciate you taking a few of my calls this week, and we did come up here and was met with very good service, so appreciate it.
You're welcome. And we are looking at having a telemedicine center in the future. This has kind of had us go in a direction that we had planned on a little quicker, where we will have that availability for after hours calls and things of that nature, and have a staff that staffs those phone lines. We're not there yet, but that's something that's definitely on the future of where we're going.
Okay, thank you. Counselor Piskowski.
I'm just gonna make sure that, on the location for the vaccine, everybody can still call that 833-528-0063 number, and then they'll put them at the local, clinic, is that correct?
Dr. Jones, if you'll remind me, the last four digits are 4099, actually.
Yes, they are. 539-234-4099. I'm sorry, I didn't hear all of the question that was being asked.
She was just verifying the number to call to schedule vaccination appointments. So originally, we did broadcast another number, and through those experiences, and we started to flood some of our other staff, we created a different call center. And so when we went to phase 1B officially, that's when we transitioned over to the 4099 number.
Can you repeat that number, please?
Yeah, it's 539-234-4099. And you also have the availability through the patient portal. So if you have a chart already established, you can access the patient portal, and you can schedule an appointment through the patient portal also.
Counselor Piskowski, is that all you had? Okay, Counselor Legg.
Dr. Jones, we were talking a while ago. Once you receive the vaccine, and let's say you got either the one or the two, either one, is this going to be an annual thing, like the flu shot, or once you get the vaccine, is it going to be a one and done type thing, or we're going to have to do this every year?
Well, we don't know that yet. Research is still out on that. From what I'm understanding through the media, which I get the same information you do, they're looking at probably a booster each year. It depends on how things, how the different mutations occur and how the variants occur. And like any virus, it mutates and adapts. And according to what we're understanding is they have the ability to also adapt the vaccine in a way that will pick up those different mutations. So we're anticipating that probably in the future it's going to be a once a year thing. So in light of that, we are making plans on what we're going to have to do staffing wise to be able to vaccinate the tremendous amount of people that are going to vaccinations every year. The flu shot is something that we can look at and pattern after, and hopefully the boosters will just be a one-shot vaccine, in the future, but we don't know that yet.
Okay, thank you. Counselor Duncan?
I was just going to clarify, Dr. Jones said that the council had funds to help with gas money, and before that rumor gets started, I wanted to say, no, that's not accurate. And the other part of that, I wanted to tell you, Counselor Buzzard, is that anytime I have somebody that's going clinic to clinic that is having trouble with transportation, I called Andy Quitone with transportation, and he sets up a ride for them. So that's an option for you, too.
Yeah, I believe they have a bus that's been modified to with a divider in it that allows them to transport people safely.
Okay. Counselor Austin?
Yes, a little additional misinformation regarding Claremore Indian Hospital and new mothers. My daughter gave birth through the Claremore Indian Hospital. I don't know if George is still here and can hear us, but they have every Cherokee citizen who's north of 412. They have every reason in the world to go into that place, and they do great work. They are taking care of new mothers and babies phenomenally well in Claremore, and they have full laboratory services. So there's really no reason for them to come to Tahlequah.
Very good. Very good. Yes. Counselor Buzzard?
I just want to go back and let Dr. Jones and Counselor Austin know Hastings Hospital is probably the #1 hospital in this area that delivers babies. And that's the reason we have a lot of Cherokee people that use this hospital. They can use Claremore, and it's a good hospital. We use it. But I'll tell you why. That's the reason we have so many that use Hastings Hospital, because it's rated #1 as far as pregnancy for people to deliver their babies. So, yes, that's why we use Hastings a lot, because it's #1. So thank you for that, Dr. Jones. Thank you.
Very good. Anybody else? Counselor Shambaugh?
Real quick, Dr. Jones, I want to thank you for taking my call very early this morning. I'm surprised you were in the office that early, but I guess you are every day. But the information that you gave me about the patient advocate kind of calmed them down a bit, and I didn't get a call back, so apparently everything went good. So I want to thank you for that. And as far as our phases, you seem to be on schedule with the phases too, because I know I had talked to you a week and a half, 2 weeks ago about a handicapped person who had a underlying issue, and you said it would be 2B, and it would be about a week and a half, possibly 2 weeks. And are you happy with our schedule? Because, you're pretty much right. We're on 2B right about when you said you were. Are you happy with the way that's going?
Well, we'd like to go a little faster, but it's all due to allocation. How much vaccine we're given from the Indian Health Service. And as we've been given more vaccine, we've been able to ramp up our services and scale up our services so that we can take more appointments. We're tracking it very closely to make sure that when you get the first dose, you have a second dose available to you. We are getting a tremendous amount of people contacting us for their second dose that are getting their first dose through the state, because the state is not planning accordingly. And so you get your first dose, and then it's up to you to figure out how and where you're going to get your second dose. So we're starting to get a lot of people that have gotten their first dose through the state that are wanting to come to Cherokee Nation and get their second dose, which throws your ratios out of whack if you start giving those second doses. We're working on a plan to be able to accommodate those folks that are beneficiaries that need that service, that can't drive across the state to get their second dose as the state has put them in that kind of predicament. And we have a plan that we're going to start working through this week and next week to be able to help those folks that are needing that service. It's a logistical nightmare right now with where all of our planning is based on how much vaccine we get. And if we don't get it, we can't schedule those patients. So we can't get too far ahead of ourselves, or we will schedule patients and not have the vaccine to give them. So we'd like to go a little faster, but we're doing it as fast as we can and doing it as methodically and logistically as we can.
What about, I've had numerous calls about elders who can't get out of their house. They want a possible nurse to come and give them shots. It's my understanding that's being looked at as a possible way to help things in the future.
Yes, we are working on what we're calling homebound teams for patients that are at home and can't get out. The challenge is it needs to be for a need, not for a convenience. Because obviously we're going to have to, the logistical part is how long you have to work with the vaccine once you bring it up to temperature, and how much can we thaw out at a time and still hit those needs and not waste any. One of our primary objectives was to waste as few vaccines as we can, and each time we thaw a vial out, if it's a Pfizer vial, you get 6 doses. If it's a Moderna vial, you get 10. So you don't want to thaw a vial out and only have 2 doses to give. So there's a lot of logistics, a lot of things that have to go into that, and planning how you're going to hit how many people you can get in a very small time frame once you start sending people out to administer to those people that are homebound, and how we schedule that. So we're working on it. We're working on a plan, and we're hoping to have that put in place shortly.
Okay. And the last thing, and it goes back to rides. You know, I've had numerous calls about people needing rides too, and I've called Human Services to see if they could assist with money for gas. And I hate to say it, but well, I'm going to have to say thank you again for Steve Carey. That guy, I dump on him. I'm sorry, but I call him when somebody can't get a ride, that, you know, they've had a pre-existing condition, they need to go back. And he's always been very good about taking all my calls, and he says, hey, Councilman, I'll look into it, I'll try to find them. And he usually gets things taken care of. So he wears a lot of hats, and I would like to say thank you for Mr. Carey, because he's helped me a lot on a lot of billing. You know, I know there's issues with Claremore when they run out of money. And, you know, people are getting letters from lawyers getting ready to get sued. And Mr. Carey's has been very involved in that and taking care of people's credit and getting those things taken care of. So I'd like to say thank you. But he has helped me to find people get rides too. I don't want to dump on him, but you ask for it, he'll do his best to help you. So I just want to say thank you. The guy does a good job.
He does a wonderful job.
Counselor Dobbins.
Yes, Dr. Jones, do you foresee any change in our policy of vaccinating non-native spouses?
It really depends on the allocation of vaccine, and right now we're trying to work through and get all of our beneficiaries, but we do have just like testing, we opened up testing to non-beneficiaries during the holidays when we were at our peak to try to help people identify and box in that virus. So we still are looking at that, and as soon as our allocations get up, we would like to do that. We're going to we're also engaged FEMA. FEMA will help us to also vaccinate non-ins. So we've started engagement with them, see if there's something we can work together and try to get allocations for that purpose. So it's not beyond what we can do. We have the ability to ramp up and do more, but it's just going to depend on how much vaccine we can get a hold of.
Okay, thank you, Dr. Jones. Thank you, Chair.
Thank you. Anybody else have any questions?
Dr. Jones, I have personally accompanied some of our tribal Dr. Jones, I personally accompanied some of our tribal members to get their vaccinations. And I want to commend the staff for really the little orientation they do. They make you feel comfortable. They give you that calming information about going and taking your shot, because a lot of our speakers were very leery in the beginning. But I'm getting calls from tribal leaders from throughout Indian country, far west is Navajo, and north around the Lakotas, about how we as a Cherokee Nation is handling this pandemic and how we are administering the vaccine. So I want to let you and your staff know that, we are probably, I'd say we're not perfect, but we're really close right now. We're way ahead of the state. And the state could really take a long, hard look on how we're handling this pandemic and how we're doing things. So I just want to commend you and your staff, how well of a job they're doing. They're really out there in the front. And this makes me proud on our Cherokee healthcare and how we're taking care of this situation. So, with that, I just say I appreciate everything you and your staff are doing. Thank you.
Yes. Dr. Jones, I just have a few questions. Can you tell me how much vaccine we're getting?
Each week we get, and they're telling us that we're going to start being told 3 weeks ahead of time, but that hasn't happened yet. But each week we get notification on how many boxes of vaccine we'll get. Recently, we've got a large amount of Pfizer in one shipment, and then we took that and distributed them out to all of our clinics so that every clinic could start administering the vaccine. But we don't typically know until the week before on how much we're going to get the next week. And it is dependent on how much we're using is what we're being told. So we're using every bit that we get each time we get it.
Okay, and so we have the special freezers that we needed for the Pfizer vaccine at every clinic, is that correct?
No, we just have them at some of our clinics. We have it at the special freezers at Muskogee, Bonita, Salisaw, and Tahlequah. And then the Moderna does not require the special ultra cold freezers. So the Moderna vaccine is being distributed out to the clinics that don't have those freezers. We were ahead of the game, and we put our orders in and got our freezers early before the shortage, and toward the latter part of when people started realizing they needed freezers, there was a shortage on them, and it was hard to come by. So we were fortunate, and we planned ahead and had those freezers already on site, wired in, and monitored to be able to utilize them as soon as we were able to get the vaccine.
Very good. Just out of curiosity, we are on 2B right now in the vaccination process, is that correct?
That's right, yes.
Okay. Was there any disruption of services with the weather from the last 2 weeks?
Oh, last week we did have some disruption of services. We actually closed our facilities on Monday, Tuesday, and Wednesday. We did continue to do televisits and video visits where patients were able to have, had the ability to communicate with us. We did have our docs and seeing those and tending to those patients. We kept our hospital open and kept it going, and several of us took turns giving people rides to and from work to make sure marshals jumped in and helped us to make sure we had adequate staffing to keep our hospital running.
Wonderful. I have to brag on our healthcare workers. They are running this distribution program like a smooth, finely oiled machine, and I'm so proud of how well they're doing this. And I think Cherokee Nation has surpassed Oklahoma on our vaccine distribution. These people that we have in charge of this should write a book as a guidebook on how to distribute in the event of a crisis in the future, because they are that good. And I hope you all know it. I just want to share that with you. You compare this program against any in the nation. I mean, Cleveland Clinic, John Hopkins, and anything else. They're outstanding, and we are so blessed that we have this team in place. Okay, any old business? Yes, sir. Please.
So I wanted to address Councilor Buzzard's concerns regarding labor and delivery, and I think kind of try to fill in the gaps between Councilor Buzzard and Dr. Jones. Typically, yes, we would not pay for transportation to and from the clinic. It's typically related to those that are being sent to a third party, to Oklahoma City, Tulsa, things like that, and will help with contract health. But because of the pandemic and because we haven't been running our shuttle services due to COVID, then Dr. Jones and the health team has been trying to find ways to help people bridge that gap. So it's a little bit of both as far as the transportation. But I think long-term, dealing with the staffing issues related to labor and delivery, obviously we're going to deliver babies in the hospital rather than a clinic. But I'd like to work with Dr. Jones and team to work with telemedicine to do as many of those visits remotely through the clinic unless there's extenuating circumstances where they have to physically be in the clinic. But to try, as Dr. Jones pointed out earlier, we're looking at a telemedicine bank basically so that you could call in and see a doc and we could try and schedule as many of those appointments in their local clinic and then up until the time of delivery, then they'd have to make their way to the hospital. So I think there's some solutions there, and I agree that is a long way to travel. I know that I have 3 kids. One was born at Hastings, one was born in Salem Springs, and the other was born in Tulsa. And the first one was born in Tulsa, and I remember waking up at 3 o'clock and having to make a left-hand turn on Highway 82 and thinking, why can't we just go 10 miles to Tahlequah and we'll be at the hospital? So it is a jaunt for parents to be making. So let us work on that and see if we can't come up with some solutions that'll make it easier on our citizens.
Counselor Besser?
Well, I just want to thank Todd for making those statements. And I just think a lot of us in here, we don't hear what problems we have in our particular area. But this, about what we just talked about, the pregnant ladies coming to Tahlequah, that is really a problem. If you're a poor Cherokee family, you got one income coming in, and the lady may be making the income, and she's got to take off, and she works at the chicken plant in Jay, and come all the way to Tahlequah and spend a half a day, 5 or 6 hours. That's wages lost. So anyway, I just want to bring it up, and I just thank Todd for saying he's going to take a look at that. And I just think it's going to help a lot of our people. I hate to keep saying poor Cherokees, but that's reality. You live out there in the rural areas, and that's where I live. You see those things. If you live in a town that's got a hospital available to you, it's not quite as bad. Not bad. There's another word for that, but you got that access. But if you live in Piney, Oak Hill, we don't have a hospital in Jay. We have one in Grove, but then you got to pay for that service, and that's the reason they want to come to Tahlequah. And I just told Dr. Jones a while ago, and the reason people want to come to Tahlequah, that is the #1 place to have your babies in Tahlequah. And that's the reason people want to come to Tahlequah. But I appreciate the fact, Todd, that we can look at that, because I look at it from a standpoint of a Cherokee family that maybe not have the money to drive to Tahlequah, and it's just a matter of fact in life that's the way some of our people have to get by on anymore. So thank you for looking at that. I appreciate it, and I think Dr. Jones, they're doing a really good job up there. I mean, what he wrote me in the email, it made really good sense, but still there's some more that we just talked about that can be looked at that could help our people tremendously. Thank you. Thank you, Madam Chair.
Okay.
Madam Chair, if I could say one more thing.
Yes, sir.
I would like to address something and make sure it's clear. In Stillwell, at the clinic, we have construction issues. It's great that we're expanding our clinical operations, but because of the construction there, it's been very congested. With testing at one point in time, we had traffic backed up for a half mile on the road. And so we have taken part of our CARES Act funding and constructed a facility. And we originally intended it to be a testing facility. But due to the vaccine rolling out, we're now using as a vaccine distribution facility there in Stillwell. And so that is one of those areas that we're opening that up and expanding the vaccination clinics to now include Stillwell, where it might have been a problem with congestion around the clinic. We are actually using this new facility to administer the vaccination clinics. And so Dr. Jones and team have been working around the clock. Originally, we were going to start that last Monday, but due to the weather, we've postponed that rollout. But this week, we are starting to ramp up, and you'll start to see more and more vaccines throughout the 14 counties, throughout all the clinics. In particular, I want to point out Stillwell because it's kind of a special circumstance and a special issue that we're dealing with there, and that building is going to help us deliver thousands and thousands of vaccines to possibly save thousands of lives. So just wanted to point that out. Thank you.
Very good. Okay, is there any old business? Any new business? Okay, announcements. I'd like to announce that our next meeting is scheduled Monday, the Ides of March at 1 o'clock. Take a motion to adjourn. Motion's adjourned.